Hi, my name is Anna Sepanski, and I will be sharing my evidence-based research when designing for individuals with dementia. So a few things that I'll be going over in this presentation today are the abstract, research questions, methodology, findings, design considerations, conclusion, and my references. The goal of this research is to find ways to create a supportive built environment for individuals with Alzheimer's disease. This will be completed through the designing of a new Alzheimer's care facility. The research for this project will be collected through scholarly literature reviews, the appropriate design theories, interviews, a precedent study, and analysis of the building and site. All of the findings and research will be used to help discover supportive design considerations needed for the new facility. In addition, natural daylighting interventions and biophilia will be implemented into the design of the care facility. The goal is to allow the residents to wander, remain active, and feel a sense of independence. Finally, wayfinding and color theory will also be considered when programming the space by grouping the necessary amenities and spaces on a foundation that is easy to navigate and to understand. In the end, the accumulation of these research findings will provide a visual demonstration of how these design issues may be addressed through the development of plans, sections, elevations, renderings, and furniture and material specifications for the Alzheimer's care facility that is to be located in Paradise Valley, Arizona. So my research question is, what characteristics of design would create a supportive environment for individuals with Alzheimer's disease? And the methodology to help discover this answer has been conducted through literature reviews, design theories, interviews, a precedent study, and analysis of the building and site. The literature reviews that I looked at were over daylighting interventions and Alzheimer's behavior, a model for designing for those with dementia and Alzheimer's, social space designs that support aging in place, specialized design for dementia, new combinations of housing and care for the elderly, wayfinding in dementia, and understanding the consumer perspective to improve design quality. And the design theories that I've researched are person environment theory, sense of place theory, interior ecosystems. And for my interviews, I interviewed a daughter of an Alzheimer's patient, an employee at the Ridgely Assisted Memory Care Facility, and the owner and manager of Fountain Hills Assisted Living and Memory Care here in Lubbock. And then my precedent study was the Lou Ruvo Center for Brain Health in Las Vegas, Nevada, which you can see these two images are from there. And that's what I've used as my precedent for the building. And then analysis in building and site was conducted by taking a look at the surrounding environment of where my new facility is going to be placed, and I chose Paradise Valley, Arizona for that. So the findings that I've discovered are that gardens, especially enclosed spaces, provide an environment preferred by those with Alzheimer's. And so in my new facility, I'm going to incorporate a courtyard in the center of the building to allow residents to walk around and get fresh air. And elderly care facilities must support users' physical health and mental well-being. Physical health building features include physical proportions and abilities, safety, accessibility, and convenience. And then the mental well-being errs on the need for privacy, shelter, and social interaction. The built environment affects the quality of the patient or family members' experience in a healthcare facility, and traditional elderly care environments are not suitable for those with dementia. So based off of the findings and research that I've done, the design considerations that I'm going to be implementing into my new facility are natural daylighting, exploring the use of biophilia and creating an exterior garden courtyard with a path for with plants to allow residents to wander, remain active, and feel a sense of independence. And then I'm also going to consider wayfinding and color theory when programming the space by grouping the necessary amenities in spaces on a foundation that's easy to navigate and understand. And I'll be doing so by the choice of materials and colors in the space and how different materials can help individuals get places without having to need like appropriate signage and stuff, and really just using what's surrounding them to help them find their way through the space. So In the end, all of these design considerations will be implemented to benefit the individual user of the space. The goal of the new facility will be to have the residents feel safe, loved, content, and secure. And then, being that dementia and Alzheimer's patients are very independent, it's important to do whatever it takes to help these residents feel more independent. And then here are my references, which I accumulated through the research that I've done over the past semester. So thank you so much for your time. I hope you enjoyed this presentation.